without further ado, I'm going to introduce you to Dr. Littell.
Well, thank you. Love you all. This is a great group, and I walk around a lot when I talk, so they said I could just pop that out, and I'm going to pop that out. So, yeah, this is, we live in interesting times, and really, I think you're all in for a little bit of a treat, because to my knowledge, I'm still, and certainly during COVID, this was true, the only doctor in America that took care of patients in the hospitals, nursing homes, and in my office. And in their own homes, actually. I'll never forget the pastor's wife, another lady, Karina. I went to people's homes. I had phone calls. We had over 3,000 telehealth visits throughout the country of people desperate for care. And to this day, I've been on the phone with hospitals and ERs this whole weekend up in Ocala. And I think it's important for all of you to hear what is happening now. We're not done with COVID, folks. We should be done with COVID, but we're not done with COVID, and there's a reason for that. And I think it's important for everyone in this room to hear what I'm going to tell you today, because quite honestly, I'm shocked and I'm disappointed to have to tell you what I'm going to tell you about the healthcare profession right now. So let's get going, all right? So yeah, this is advice from your family doc. I didn't put my name up there because I didn't know if I should be Dr. Doolittle or Dr. Littell, so I just left it for you to figure that out. But don't believe the BS. That's the subtitle, right? Don't believe the BS. And you've all heard good stuff about that. So here's the deal. What I discovered in the last 4 years, and what's written in my book, which is in that back table over there, called The Hidden Truth. This is a new edition. Actually, let me read what I wrote in the preface to the new edition here, okay? This was written while I was flying out to Alaska with, I get about 10 days of vacation every year. All right, so I'm 66, I get 10 days of vacation. That's how busy my practice is. But we did go to Alaska last summer. And on the flight over there, this is what I wrote. All right, let me see, figure it out here. I get to the right page, I'm sorry. Prior to the age of SARS-CoV-2, also known as COVID-19, the subtitle Deception in Women's Healthcare, which is the subtitle of this book, may have seemed too harsh. Deception in healthcare? In the aftermath of COVID-19, with its CDC-initiated non-evidence-based mandates for everything from masking and quarantining to the promotion of untested mRNA injections, distrust of the medical profession has reached epic proportions. I see that each and every day. Patients took it upon themselves to become informed about the appropriate preventive and treatment options for the emerging new variants of the age-old coronavirus. They lost their trust in their physicians, who increasingly were blindly following a script put together by agencies such as the CDC, FDA, insurance companies, hospitals, many of which, sadly, now own your physicians. Yeah, your physicians are owned. And I'm one of the few. I'm thankful I'm independent. I have a daughter, Dr. Ann, takes care of some people in this room, actually. She's over in Kissimmee in my practice. But frankly, the only solution to all this nonsense is to preserve the independent practice of medicine. But most importantly, throughout all of medicine, to embrace basic science. And as I discovered in the last 4 years, you all got a better understanding of science than your doctors. So, for example, in microbiology, epidemiology, immunology, pathophysiology, and pharmacology, okay? My patients had a better understanding than most of my colleagues in medicine. So let's just go through this, because you guys will now know more than your doctors, a lot of them, okay? Microbiology 101, the coronavirus. I studied about coronavirus in my microbiology textbooks at George Washington University in 1984. So, coronavirus has been around for eons. Probably Adam and Eve had the common cold, okay? Well, maybe after they sinned anyway, after the sin came. They were really healthy until that apple came into the picture. But anyway, they got the cold. That was the first thing that happened. All right. It's an RNA virus. It's ubiquitous. With all due respect to the wonderful speaker earlier who said he never got COVID-19, I argued everybody got COVID-19. You could not avoid coronavirus. You never will avoid coronavirus. if you're fortunate enough, as we'll discuss later, your immune system will handle it superbly. And that's what happened with many people. Those you didn't hear about those. So it is a common cold virus. Of course, what we did see with the Chinese Wuhan variant, which was weaponized, was the emergence of only three variants that were lethal. All right, Alpha in 2020, Delta in the beginning of 21, and Gamma, which didn't really hit our country, mostly in South America and other regions, but didn't really come to us. So we had Alpha and Delta. All right, and of course, if you remember 21, and I have right here, these are all the patients in the hospitals I took care of in 2021. There were a handful that passed away. Others I was able to get out and get them appropriate treatment. But unfortunately, once they landed up in the hospital, even with me taking care of them, my options were limited. Because again, the hospitals denied me the right, except for one person, denied me the right to take care of them in the right way. So that was with Delta especially, and I lost a very good friend, and Kissimmee, my closest friend, got the death protocols over there at Advent Health in Kissimmee. And I could go on and on about that. We all know we've people who died unnecessarily. And then what's happened since January of 2022, that's a long time ago, right? Over 2 years ago, we've had Omicron and then Omicron subvariants. And people have been trying to make this into a big deal. Well, the thing that happened, among other things, is we started rolling out these tests. And Joe Biden, if you remember, mailed tests to everyone in the country. Why would the President of the United States of America, the first time in history, mail tests to everybody in the United States of America? What you know what that was? Obviously, it was to perpetuate the fear. To everybody now, when you have a cold, you shove a swab up your nose. When your kid has a cold, you shove a swab up your nose. I've had 2 cases. I was in Montana for my other second vacation this year, just for 5 days. A week ago, while I was gone, I had a mother of a 7-month-old take her child down to Haines City, heart of Florida, with a fever, 104. Positive test for COVID, IV fluids, blood cultures, the whole 9 yards for the 7-month-old baby. If the mother had reached me when I was in Montana, unfortunately I was in the one part of Montana outside of Lewistown where you couldn't get a signal, and I couldn't get a hold of her in time to tell her, don't go to the ER. But she went. This poor kid was traumatized, and at the end of the 7 hours, they said, okay, go home, there's no treatment, he's got corona, COVID. But now they're all afraid, she knew not to be afraid. At the same time, I did get a phone call from the emergency room up in Ocala about an 80-year-old gentleman who also, they said, had COVID pneumonia. They wanted me to put him in the hospital, and they came up with all this cockamamie stuff that had nothing to do with COVID. And I said, let me talk to his wife. And I got her on the phone in the emergency room, and I said, you don't want your husband in the hospital, do you? She said, I don't want to be here, but I brought him here because he had a fever and he was kind of weak. I said, well, you know what, you get home and you get some bone broth, beef broth, chicken, and you just stay home and do not come back to the hospital. And I saw him in the office on Monday, and he's fine. But had he been admitted to a hospitalist and gotten the death protocols, which they're still giving, whole nother story. Hospitals and hospitalists have no incentive to kick you out of the hospital. No incentive. We know that already. So that's what Omicron is still being tested for and called COVID, and people don't realize it's not the Alpha and the Delta variants that were actually weaponized variants. We've gone beyond that. All right, epidemiology, this is huge. All right. The case definition of COVID, there's some of these videos went out on my website, John Littell, MD, but YouTube took most of them down, but they're still available on my website. I just talked about how these 5 epidemiologists in the Midwest came up with a case definition of COVID right in the beginning of 2020, and early 2020, and it was this, anyone with a flu-like illness had COVID, even without a test. This is why influenza disappeared for 2.5 years, and to this day still is not existing, because that case definition still exists. All right, so anyone who's got 104 and flu-like symptoms or whatever, or even if you're in a place where other people tested positive and you're sick, you've got COVID. This is what happened so that all this nonsense could roll out and people would be told you have to get the shots and the treatments. So the testing went bananas because of this case definition. As you know, our governor here in Florida was one of the few that did the right thing. He said you need to have so many cyclic threshold. There's a cyclic threshold. You have to run the test at least 25 times to make sure it's a true positive. And DeSantis said we should do that. These rapid tests aren't doing any of that. They're not doing any of that. So when you hear people testing positive for COVID, it's nonsense, nonsense, nonsense. Let's stop the testing. It's making billions of dollars for these companies who sell the tests. And of course, Biden wants us all, and of course, Harris will. The transmission of COVID, okay? You know, you can't not get COVID. But the things that we need to know is that it wasn't because of touching things. You know, your kids were in school, or you go to church, and everyone had the wipes in the church, and people were wearing gloves. And finally, after about 6 months, Nature, which is the medical journal that we can still trust, which had Watson and Crick and Einstein, all these people published in Nature, comes out and says, why are we doing all this wiping down? You know, it's not spread from touching. It's a respiratory virus. To this day, you still see people sanitizing everything, as though every germ is harmful. Of course, we know that otherwise. So transmission, this whole idea of the 6 foot, I can go on and on about why I told people in the very beginning, get COVID. Stop the masks, stop the isolation, stop the quarantining, go to church, mingle with people in church, shake their hands, whatever, get the COVID, get over the COVID, and you'll be healthier than anybody. And that's all of us in this room, presumably, all right? Get COVID and get better. Build up your immune system, that's later. Okay, so natural history of COVID infection, simply put, is that it's about a 5 to 7 day illness. Right now with the variant we currently have, yeah, people are sicker than they have been in a little while. I'm seeing that. I'm seeing people with more protracted coughs. But I've been in practice 35 years. I've seen this before. This is nothing that surprises me. Some people keep a bronchitis for 2 to 3 weeks or even a month after a viral bronchitis, a viral infection. It could be coronavirus, could be echovirus, could be adenovirus, could be a bunch of viruses. Influenza, obviously. All right, immunology. Let's keep moving here. Optimizing immune health. I visited with a lovely nutritionist earlier, and there's many of you in this room who know what you need to do to stay alive and well through better nutrition. Vitamin D was not talked about at all. I'm sure you all are familiar. I take about 5,000 to 10,000, depending, units every day. But if nothing else, get your vitamin D levels checked. I hope everyone in this room, by the way, reproductive age women, vitamin D essential for healthy babies, okay? Preventing miscarriages, preventing preterm labor. So vitamin D levels over 50. Everyone in the country should be checked for vitamin D levels, especially those who don't live in the Sunshine State. But in the Sunshine State, you have all these crazy people saying, I can't go out because I'm going to get skin cancer, and they have low vitamin D levels. Get some sun, guys, at least 20 to 30 minutes of sun every day, all right? It's a Sunshine State. Enjoy it. Natural immunity, okay, did occur after COVID. It occurred for me. I got alpha, and I also got a hint of delta. I got sick. I have asthma and use inhalers and whatnot, but I got over it because I did the optimal nutrition. I took the vitamin C and zinc along with the vitamin D, and then I'll tell you about some other stuff in just a little bit. But natural immunity is what really occurs when you have infections like this, and what happens when you roll a vaccine out in the middle of a pandemic is that you short-circuit the natural immunity that's occurring throughout the country, and that was intentional. That was intentional. We were just getting to a point where people were getting well, and then bing, we started injecting mRNA into their arms and propagating, perpetuating these dangerous strains of COVID, the dangerous variants. Intentional killing of Americans. All right, so antibody detection escape, that's the phenomenon when you inject people in the middle of a pandemic. Your antibodies are just starting to fight the variants that your body was exposed to through the mucous membranes. It's a respiratory virus. It comes through the nose and the mouth, and it has to deal with all the immunity that starts at the tip of your nose and inside your mouth. That's where mucus comes from. Mucus is your body's inflammatory properties, and antibodies are in there, and it's fighting. When you inject it in the arm, you are bypassing your natural immune defenses, and you're leaving people helpless as those spike proteins got to their hearts, to their lungs, to their reproductive systems, to their brains, where I saw microangiopathy changes in people who started to have memory issues after these vaccines. All right, so we did an incredible disservice with these injections, and it was intentional. So there is just no justification for any vaccine. Forget about COVID for a second. If you look at my immunology textbook from George Washington University, it says, when you decide to come up with a vaccine is only when there is a lack of available effective treatment for the disease, number one, and where the inability to stem the disease, this tide of disease, will lead to widespread death, okay? You don't just vaccinate billions of people when it's a self-limited disease that's not going to kill people. We are doing that to children each and every day by the millions in this country who are still vaccinated against trivial diseases like the ones that cause ear infections or rotavirus, which causes diarrhea. And they're getting, just all these unnecessary vaccines. And this is true with this one. And we did have effective treatment. What were the two? What's the big one that you all know about? Ivermectin. And of course, even President Trump knew about hydroxychloroquine. So, we know that, you know that. Of course, the doctors would not accept that. And so when you address what COVID does to people, you have to consider viral penetration. You have to stop that virus from getting into the cells and from replicating in the cells. And that's exactly what the ivermectin, and before the ivermectin, the hydroxychloroquine did a masterful job. With the alpha variant, all we needed was hydroxychloroquine. I took hydroxychloroquine, otherwise known as Plaquenil, for the alpha variant. I did fine. Unfortunately, what happened during the Delta wave in 2021 is that was so better weaponized as a variant, and because the vaccine had rolled out, the coronavirus was able to figure out how to escape, as I just said, our natural immune system. So we needed more weapons, and those of us who were doing it actually added ivermectin to hydroxychloroquine and a bunch of other stuff, by the way. It wasn't just those two things. So we had to fight the inflammation, we had to fight the microclots, the thrombosis, we had to fight the hypoxia. I can remember, and I can share this with you because I know he will share with you, is Matt Staver from the Liberty Council calling me desperate, hypoxic, could not get oxygen. We could not get oxygen for patients of mine. I called Apria, the #1 distributor of oxygen, as a doctor, and you know what they told me here right in Orlando? They said, they asked me on the phone, "Is the patient have COVID?" I said, "Of course the patient has COVID. That's why we're trying to get the oxygen." They said, "Well, no, we have to prioritize right now. We're not doing COVID patients for oxygen." They were not delivering oxygen. They literally had a policy to not deliver oxygen to COVID patients. The inability to get oxygen was one of the most evil things that happened in our country. Evil, evil, evil. I mean, allowing people to be hypoxic. And I had to deal with this. You have no idea the hours we spent trying to everywhere to get oxygen for people. Because if you don't do all the other processes are just that much worse. But that's what's happening. That's part of that cytokine storm, is the inflammation that we only saw with Alpha and Delta. I can't say this enough. I just put out a Facebook post yesterday. The current variant is not killing people. It is not lethal. Yes, there are people dying in the hospital who test positive for COVID, just as they were in 20 and 21. I had a patient who had open heart surgery, who had complications of open heart in the very beginning stages of Alpha, and the hospital was going around testing anybody that was actively dying or in imminent death to see if they could test positive for COVID so that the hospital could get what? Money. If they died from heart failure after a heart surgery and they were tested positive, if they died from a motorcycle wreck, and I had funeral home directors telling me all this stuff, and of course I saw it firsthand in the hospital. But I couldn't get COVID tests from my nurse who took care of the first patient who died. My patient, who's the nurse who was taking care of the first COVID death in Ocala, said, "Doc, I think I have COVID." I just got a call from her today, actually, Mel. She's the one, she knew about Plaquenil. She knew about hydroxychloroquine. She said, "Doc, I think I need hydroxychloroquine. I have COVID," and she survived. Her patient died, but she couldn't get the test because the hospital was only holding them for these people in the hospital that they could make the money off of. And if this is on tape, that's wonderful. That's great. Because to go back to these hospitals, they were terrible. On my phone, when you talk to Siri, I'd say remdesivir, and Siri would come back remdesivir. It was amazing. That's to this day. Just try it with Siri. Siri knows. This is what it does. It caused my best friend to go into kidney failure. Never got off of the ventilator, all right? We know remdesivir is a hoax. We also, I mean, everything that happened in the hospital, I'd have to write a whole book and spend a whole day talking to you because, again, I was going, and I get emotional, so I won't go there, but I would literally go in to make my rounds, and people would corner me that I'm not even their doctor, and they would say, "Can you go see my husband, my father, my son, my daughter?" Because I can't even see them. "And can you at least tell me how he is?" And I'd say, "Okay, I can pray with them. I'm not their doctor, but I'll pray with them." And that's what you do. All right, so that was tough. Those were tough times. I had to sneak the pastors in. I had to sneak the priests in. I had to sneak the family members in. And that's another story. We'll be talking about some of that still. We can't forget that stuff. We can't pretend this never happened. If we pretend this never happened, I know this group won't. But as a country, if our collective memories forget what happened just these last 3 years, we're lost as a country. they know, they want us to forget. We have to remember how wonderful these other medications were. Dr. Steve Hatfield will be at my conference in October. There's information back there. Others, he was in the White House across from Janet Woodcock and Tony Fauci, begging them to put hydroxychloroquine in the stores, in the national stores. And Tony Fauci looked at him and said, no, we're working on a better thing. We got a better thing figured out. We don't need the hydroxychloroquine. Where are you going with all that stuff? And of course, they ridiculed our president for even mentioning anything like that. So these are all macrolides. Ivermectin, IVM, there is a macrolide. It's in the same category as Zithromax. I keep trying to tell people it should have been called ivermectin, and then maybe people wouldn't have ridiculed us as much for using it. All right, and then the anti-inflammatories, my friend Pierre Corey, who will also be at the conference, is, first out the chute to say we need high-dose steroids for these patients. He was a critical care doctor. By the way, both he and Dr. Paul Marik, both critical care doctors, both lost their licenses to practice medicine, both recently decertified because of their views along this area. So this is the kind of stuff that happened to me for a while, as some of you may know. And the use of blood thinners, which got me in trouble, but I won't get into that. I did actually criticize a critical care doctor in my hospital for the people that died on his watch, and I got in trouble for getting mad at him. But that's another story. The bottom line is I saw people dying left and right, and so did the nurses and the respiratory therapists. And some of my biggest heroes are the respiratory therapists who had to go from one bed to the other and knew darn well that these people were being denied care. And they'd come up to me and I'd give them a hug in the hallway. The nurses, it was just so dang tragic. So you've all heard enough about the myths, debunking these myths, but I already said, we didn't need to sanitize the desk. We all know we didn't need to wear the mask. Thank you, sheriffs who enforced. I shared this story. There were a group of doctors there still are, a group of doctors up in Marion County. They call themselves the COVID Alliance or something like that, and they all were wanting everybody to do all this stuff. And I actually got in on one of their phone calls, and they said, why aren't we talking to our mayor and our sheriff and our chief of police about the people not wearing masks and not distancing in this county? And I perked in, I said, listen, you guys are so off the page. In our county, not only our mayor and our sheriff and our police chief and our Congresswoman Kat Kamek, I said, pretty much the whole county doesn't agree with anything you doctors are saying. You don't even know how to relate to the patients. You're the ones, the doctors in my county. I remember one guy, he shut his office down and had all his patients see him under a tree outside the office, and he had kept his distance the whole time. Others just and many just had a policy, we're not going to see you if you're sick. And I know you all had to deal with that. You have a cold, a fever, you don't come. We're not going to see you. Go to the emergency room. Let them kill you in the hospital. So these were things that we all know, and I could talk forever about the all-in horses stuff, from the FDA. And then, please, right now, Paxlovid, Pfizer, right? All these Pfizer injections, and then they have the Pfizer cure. So Pfizer is evil. You all know that. I hope there's no Kansas City Chiefs fans. Although I will say they have a wonderful kicker. I love their kicker. Oh, isn't he heroic? If anyone know about the story of the Kansas City Chiefs kicker, he is a man that is above reproach. And then there's that Kelsey trash, and he's got to get his act together. Okay, so safe and effective. I shouldn't say that. I should be more charitable. I'm sorry. You know what? Really, we all need to be more charitable. I'm sorry. I'm just ventilating because I could do that with this group. The only way we're ever going to reclaim anything in our country is that we believe is important in our country is to be merciful, is mercy and humility. Okay, I can't say that enough. I as a doctor, pride is an issue for every doctor, and ego, and I have to learn to be a better doctor, a better person. So these folks who've screwed up, dang it, as you'll see in my book, I screwed up a lot as a doctor. I learned some better things. Every doctor, every person who's on the wrong side of this chapter of history can get right if they just come to see the way, and they see the truth and the light and the life, and they'll be there. See, that's kind of important. I've got 2 more slides to share with you, okay? Don't worry about the uptick in COVID cases. It's a distraction. There's people out there saying you got to go back to masking and quarantining. I'm seeing it everywhere I turn. Don't worry about monkeypox. It's spread from, through homosexual acts in men. It's not something that's going to affect us at all. Bird flu we'll talk about at the conference. Who to trust? Yay for the sheriffs, right? We got to trust our sheriffs. Do we trust our pastors? Yes, of course we do, except for those who were kind of weasels during COVID. But I mean, there's a lot that are heroic. Even in my own Catholic church, there were Catholic pastors who went against the bishops and said, we're going to still keep our churches open. Bishops are another story for the most part. We're praying for them. All right. And then the doctors, the physicians, I'd argue, you know, you guys need to be more advocates for yourselves and your families and stop trusting the doctors. We've all been brainwashed. It took me about 20 years to get unbrainwashed, so just pray for your doctors to come around. And then our politicians, I don't even know what to say about them. So if you want to know who to trust, we have some good ones here, by the way. I do have this book, which is the new edition. I have it in the back there. I'll sign some copies. I'm actually going over to another conference that's on the other side of town this afternoon, so I'll stick around a little bit. But this book grew out of my love of my 4 daughters. Initially, it was I talk about the HPV vaccine and all the lies that come with that, because I was there when that rolled out. And then, of course, with contraception. And I was with Bill Gates's right-hand man on population control and family planning, all right, for a couple of days. And I have that in the book, boasting about his ability to get 12 and 13-year-old girls in Africa to get on Depo-Provera, and which stops them from being fertile and destroys their reproductive life. So there's a lot of stuff. That's Malcolm Potts. Interestingly enough, Bobby Kennedy called me out of the blue at 10 o'clock at night about, I don't know, last year sometime, and said, could I contribute to a movie on this infertility agenda? So there are a lot of minds and people out there who realize the dangers of the population control, eugenics movement. I was happy to hear a lot of you all alluding to that in your presentations. And so if you're really interested in more stuff, some of this is around. This is the big event that I've done for 4 years. It'll be the 4th year now, and it's a lot of people coming, some surprise people. One of them I'm really excited about is Pete Chambers, and you got some Texans here. You know, he's been over in Texas helping to rescue children of illegal immigration for the last year or so, undercover, and he's going to come and talk about the health of these unfortunate children. But there's other stuff about vaccines in children, and of course, Dr. Malone. We're going to give you updates like you never believed. So I would just like to close by remembering, and I had it here, but it's pretty simple. Psalm 145, right? The Lord is near to all who call on him. And can we just take a second and just turn to him for a second? Lord Jesus, we just know that you are with us. Is more than 2 or 3 gathered in your name here. Would you please send your Holy Spirit upon us as we endeavor to spread your word, your truth, your light to others that we meet in healthcare and education, in our communities, in law enforcement. Protect each of us in this room as we go our separate ways later today. Thank you for the gift of your Son. We pray this in your holy name. Amen. All right. God bless you all. Thank you.